Dr. J here. We are talking about the appendicular skeleton today. As you may recall, the appendicular skeleton refers to the appendages, the arms and the legs. We've already gone through the axial skeleton, which are the bones that compose the skull, vertebral column, and rib cage. Had to pause there for a second. So axial was skull, rib cage, vertebral column. Appendicular are the appendages, arms and legs. And then I reminded you that the shoulder girdle, which contains the clavicle and scapula, are considered part of the appendicular skeleton, and the pelvis is also considered part of appendicular. All right, just like we did before, on your sheet, you're going to see the names of the bones. Sometimes you only have to know the bone. So for clavicle, you only have to know the bone. But for other things, you're going to have to know the bone and some of the structures on it. And anytime you see an asterisk, that just means that you can feel it or palpate it. It won't be on the test, but sometimes it can help you to remember where it is. We're going to jump right in, folks. Make sure you know the clavicle. Please don't say collarbone, because you won't get the points. We're going to know the real terms. Clavicle. We can look at it on its own. Looks like this, right? Clavicle. Let's talk about the scapula. So the scapula is the shoulder blade, but just like I said with the clavicle, you're not going to say shoulder blade, you're going to say scapula. Scapula. There are plenty of parts to know on the scapula. It might help you to figure out whether a scapula is a right or a left. This I know to be a right scapula, and I'll tell you how I know that. We want to have this projection on the back. So see how this comes out? It's called the spine. Well, just like our real spine, this has to face the back. This side is pretty smooth, doesn't have a spine, but this side does. So the spine faces the back, and then this, what we're going to find to be the glenoid cavity, this is where the humerus attaches. So if I put the spine on the back, but in this view, the glenoid cavity is facing the wrong way. So I know it's a right scapula because the spine is in the back, and the glenoid cavity, which is where the humerus attaches, is facing out. So the humerus can attach to it. Okay, so review that. I pointed that out because then we can start to identify some of the pieces. The spine is on the back, looks just like a spine. When you follow the spine all the way out, you get to something called the acromion process. And this is the tip of your shoulder. So you can actually feel the spine of your scapula, and it comes out to a tip, right? If I follow this spine all the way out, I get to the tip. Acromion process. Scapula, the spine runs along the back, and then the end of the spine is called the acromion process. Now on the front, smooth, there's a little more pointy projection called the coracoid process. And these are all sites of muscle attachment. Muscles is our next unit, so I'll save that goodness for then. So on the front side, there's a smaller projection called the coracoid process. I already mentioned the glenoid cavity. This is the little cavity or depression where the humerus is going to fit into. Good. Speaking of the humerus, here it is. Humerus is the arm bone, but you're not going to say arm bone, you're going to say humerus. We're going to start to pay attention also to how these bones fit together, okay? And that's why I'm introducing the bones in this way. The scapula, the glenoid cavity of the scapula, connects with the head of the humerus to form the glenohumeral joint, or shoulder. What's cool about joints is that they're named for the bones they connect. How about that? Glenohumeral joint. Joint between the glenoid cavity of the scapula and the humerus. We're also going to point out what this shoulder joint, glenohumeral joint, what it looks like. It's a pretty shallow cavity, isn't it? Yeah, and a pretty big humeral head. This means that the shoulder has a lot of range of motion. And we know that. You can move your shoulder a lot. But in an effort to have more motion, we sacrifice some stability. Imagine, look at how thin this is. You can't have both. You can't have a lot of stability and a lot of motion. So in the shoulder, we sacrifice a little stability. It's a really narrow joint surface. We sacrifice some stability to have more motion. This is one reason why shoulders are pretty easy to dislocate, because it's not a very strong articulating surface. I could go on forever. I should stop. Humerus. We have the head of the humerus. Up top, we're going to have these two bumps. One is higher and it's big. One is a little bit lower and smaller. So we're looking at the top of the humerus. The head is right here. These two bumps. We have a greater tubercle and a lesser tubercle. These are sites of muscle attachment, but they're two bumps. The taller one is the greater tubercle, a little bigger, and the smaller one is the lesser tubercle. We're going to see later on the femur, we have trochanters, which are also bumps. So it's pretty easy to get them confused. One way that I remember tubercle for the humerus is that they both have a U in them. So humerus, H-U-M, has the greater and lesser tubercle. Good stuff. All right, what else we got? There's something midway down called the deltoid tuberosity, meaning that we have the shaft of the bone, but about midway down, there's a little bump, deltoid tuberosity. To be honest, these fake bones don't show it that well, but there's nothing else here for you to see, deltoid tuberosity. We're not talking about the tubercles or the head. We're not talking about the parts at the bottom. So if I ask you for a structure mid-shaft, it has to be the deltoid tuberosity. And by the way, that deltoid tuberosity is the bump where your deltoid muscle attaches, hence the name deltoid tuberosity. Now we get towards the bottom. When you look at the bottom of the humerus, because the head's up top, when you look at the bottom, one side has a bigger depression. This side doesn't really have a big depression. The big depression faces the back. This is a right humerus because the depression is facing the back and the head of the humerus is facing in, right? The big depression faces the back and the head of the humerus faces in. Let's talk about that bottom part, okay? That great depression on the back is called the olecranon fossa. A fossa is a depression. So this big depression on the back is called the olecranon fossa. On either ends, we have a medial and lateral epicondyle. Epicondyle is a small bump. Remember we talked about condyles? A condyle is a big rounded edge. An epicondyle is a small rounded edge. So just think about on either end. You can feel these. If you feel at your elbow, you'll feel a big rounded bump on the inside and a big rounded bump on the outside. These are the epicondyles. How am I going to know which is the medial epicondyle and which is the lateral epicondyle? Because you're going to be smart like me. Well, you already are smart. But the medial side is on the same side as the head. So this is the medial epicondyle because it's the same side the head is facing, which by process of elimination means the lateral epicondyle is on the opposite side of the head. Okay, then we have probably two tougher ones, but I am here to help you. If we look down here, it almost looks like, let me get my fingers straight here. Between my fingers almost looks like a bow tie. You know a bow tie, right? Between my fingers kind of looks like a bow tie. And if I flip it over, It even more looks like a bow tie, doesn't it? It also looks like a spool, what thread comes on. People these days maybe don't know what that is, but if you go to Joann Fabrics and you get a spool of thread, it's something where it's narrow on the inside and thicker on the outsides. Well, this whole structure, the bow tie or the spool, is called the trochlea. Okay? So between my fingers here, where it's narrow on the inside and wider on the outside, like a bow tie or like a spool, it's the trochlea. Same thing from this view, trochlea. The last structure for the humerus is a rounded part. It's beside the bow tie, so I'm on the front here, the anterior side. The bow tie is over here, but lateral to that, we have a rounded structure, and that rounded structure is called the capitulum. All right? Rounded structure, capitulum. Good. As we move down, we get to the forearm. You're going to need to know both the radius and ulna. Put this down a little bit. Boop. So, first of all, let's get the sides correct. The ulna is always going to be on the pinky side. No matter how I move this, the ulna is always on the pinky side, which means that the radius is always on the thumb side. I've always remembered this, I don't know why, but PU, someone smells, pinky ulna, right? Pinky ulna. And even if I pronate, now the ulna is on the outside, but it's still on the same side as the pinky. So pinky ulna, radius thumb. When we look at them individually, these are some glue markings. I don't know where they came from, just ignore. You're not going to have this on the test to know that the glue is ulna. So here's the ulna, and you can identify the ulna because it has what I call an ice cream scoop at the end. The radius doesn't, right? But the ulna has like an ice cream scoop. Some people have said it looks like a pipe. Call it whatever you want. That ice cream scoop of the ulna is called the trochlear notch. So the ice cream scoop of the ulna is called the trochlear notch. And why is it called the trochlear notch? Because it fits into the bow tie of the humerus called the trochlea. So the trochlear notch of the ulna fits into the, this way, trochlea of the humerus. And that's why the elbow is called the humero-ulnar joint. The radius is not part of your elbow. Okay? Excellent. So ulna has the ice cream scoop. That ice cream scoop part is called the trochlear notch. The bottom of the ice cream, there's tape on here, the bottom of the ice cream scoop is called the olecranon process. This is the bump of your elbow. We talked about the medial and lateral epicondyle of the humerus. Well, right in the middle, what we're feeling is the bottom of the ice cream scoop, called the olecranon process. Now, moving to the other end, we have a styloid process. Boop. This is more towards your wrist. We're going to see a styloid process on the radius and the ulna. This is the ulnar styloid process. If we think back to the axial skeleton, we saw a styloid process on the temporal bone, and I said it was really short and narrow, kind of like a stiletto. Well, same thing here, short and pointy. Stiletto, styloid process of the ulna. So the ulna had the ice cream scoop. The radius doesn't have an ice cream scoop, but one end of it is circular, like the radius of a circle. Check that out. So the radius is always thumb side, and individually it has a circular end to it, like the radius of a circle. Speaking of, that radial part here is called the head. And then right below the head is a narrower part called the neck. Pretty simple. So the head is that radial top, and then right underneath it is a narrower part called the neck. And if we look here, we see a radial tuberosity. It's a bump. Usually this is a little bit pretty pronounced, and you should be able to see it. So that bump here is called the radial tuberosity. Lastly, going down towards this end, we have a styloid process. It's not quite as stylish and pointy as the ulnar styloid process, but it is the lowest point. So if you look at all of the radius, the lowest point here is called the ulnar styloid process. And why this matters is when we put the ulna and radius together, what happens is we have both styloid processes coming down, and that's going to be what goes over top of your hand, right? So it forms a nice little arch with these bony projections for protection. And that's what allows us to go right over the hands here. It fits perfectly, like peas and carrots. Regis and Kathy Lee. Good stuff. Let's get to the hand. Now, we have a group of bones called the carpals. These are your wrist bones. For this class, for me, you do not need to know the names of the 8 individual carpals. You do not need to know them. They're listed there. You don't need to know them. You may later. If you do want to learn them for later, there's a pretty common saying known to remember the 2 layers of 4 bones. It goes, some lovers try positions that they can't handle. Scaphoid, lunate, triquetrium, pisiform, trapezium, trapezoid, capitate, hamate. Look at me. Ha ha. But you don't need to know those. Just know as a group, these are called the carpals, which means that these are called the metacarpals, and these are called the phalanges, or the finger. If we use it on our own hand, the carpals would be the wrist bones, metacarpals are across here, and the carpals are the fingers. We're going to see in the foot, they're all called tarsals. I think T for toe for the foot. And in the hand, it is the carpals. And I think about C for carpal tunnel, near the wrist. Good. Let's talk about the pelvis. And I forgot to pick one out here. I'm going to have to go grab a pelvis, but you don't mind. Give me one hot second here. Thought there was one in there, but there wasn't. Yes. Oh, yes, my friends. Make sure you review parts of the carpals, or excuse me, part of the pelvis. As you can see, some of my colleagues can't take the tape off. So this is one half of the pelvis. Same thing we see here. I could take a picture and ask you on the whole pelvis put together, or I could just ask you on a half. If you wanted to know how these are put together, these are put together like this. Okay, so the pubic bone is in the middle at the front. Okay, that's what it looks like put together. I wouldn't ask you if it is a right or a left side. Don't worry about that. First of all, to start, there are 3 regions of each coxal bone or pelvic bone. The top is the ilium. Okay, to me it looks like an elephant ear. The top, ilium. When we get towards the bottom, there's 2 halves. The more bumpy, irregular half is called the ischium. The more bumpy, irregular half is called the ischium. And then the flatter front one is called the pubis, or pubic bone. So ilium is up top. Down below, if it's a more bumpy, irregular part, that's the back, or the ischium. If it's a smoother, flatter part, that's the pubis, or the front. Now, there's parts on each of these bones that you need to know. So on the ilium, we have the iliac crest. That's not too hard. You can feel this, okay, iliac crest. The iliac crest comes to a point on the front called the anterior superior iliac spine. And yes, I want you to spell that out. It's part of the iliac spine, or iliac crest, and it is anterior and superior. We also have an anterior-inferior iliac spine. We also have a posterior superior iliac spine and a posterior inferior iliac spine. All you have to know is the anterior superior iliac spine, or ASIS. This is the very front of the pelvis. Sometimes if it's a skinny person or maybe an in-shape person, muscular person, you can feel that front knob, anterior superior iliac spine. The iliac spine or iliac crest goes all the way up and it comes down to a spot, anterior superior iliac spine. Good. Now on the ischium, remember the ischium is the back irregular part. That actual irregular bump is called the ischial tuberosity. All right? So the whole region is called the ischium, but the actual irregular bump is called the ischial tuberosity. This is the bone we sit on. You can feel it. When I was in college 20 years ago, I had a whole class on palpations, and our professor didn't stop when we got to the pelvis. But indeed, one of the tips to palpating your ischial tuberosity was to flex at your hip and then go about mid-butt cheek. Because if you flex at your hip, you're going to move some of the glute muscles out of the way, and you'll be able to feel the ischial tuberosity. It's what we sit on, folks. We also see the socket, and this socket is called the acetabulum. That's how it's pronounced, acetabulum. It's near the S, even though it's spelled differently. And this is going to be the socket for the hip joint. So what's going to fit into the hip joint is the head of the femur, forming the acetofemoral joint. I had to think for a second. Acetofemoral joint, or a hip joint. Why is it called the acetofemoral? Because it's a joint between the acetabulum, or socket of the pelvis, and the head of the femur. Now, earlier I showed you the connection between the head of the humerus and the glenoid cavity of the scapula, and I said that it's not a really strong joint. That glenoid cavity was barely a cavity, much different from the acetabulum. The acetabulum is very deep, so the hip joint is much stronger. So in comparison, the hip joint is much stronger. It's got to support our body weight, but it doesn't allow for as much range of motion. Whereas in the shoulder, it's less stable, but we sacrifice stability to have much more range of motion. All right, so we had the ischium, this back region. The actual bumpy part is called the ischial tuberosity, what you sit on, and then the acetabulum is the socket. Lastly, we have the pubic or pubis region. This is the front. And actually, before we talk about that, the opening here, it's listed on your lab sheet under pubis, but it kind of goes between the pubis and the ischium. This is what's called the obturator foramen. Foramen means hole. Here it's called the obturator foramen. If you look on the pelvis, well, it's kind of hard to see, and I'm dropping things. What's important about the obturator foramen, this is a big opening for all the nerves, blood vessels, lymphatics that go to your lower body. So coming off your spinal cord is a collection of nerves. Well, how's it going to get from your spinal cord down to your leg? Through this opening. Same thing with blood vessels. Obturator foramen. I was getting ready to talk about the pubis bone. Here it is. So the pubis bone, remember I said that the ischium was more irregular and bumpy? The pubis bone was more flat and smooth. It's in the front. So you know the pubis bone. But here's where we have the two pubic bones coming together. This pubic bone coming together with this pubic bone. That connection is called the pubic symphysis. So I would have to ask you pubic symphysis with two of these halves together. Pubic symphysis. And if you look at the skeleton, right here is the pubic symphysis. And you can see there's a piece of cartilage in between. So we have a little bit of give here, which is more important for a woman during childbirth, but it gives a little bit of give. So I would have to ask you pubic symphysis on the pelvis together. Okay, we are coming down the home stretch, my friends. Let's talk about the femur. No one should miss the femur. I often joke in lab that if anybody misses the femur, I'm going to hit you over the head with the femur. Biggest, strongest bone. The femur has a head. It has a neck. Then we have two big bumps on the back. Okay, so head, neck, and on the back we have these two big bumps. This upper bump is called the greater trochanter. And the smaller bump is called the lesser trochanter. This is going to be familiar from the humerus, where we had the greater and lesser tubercle. Remember I said humerus? I remembered it because humerus has a U in it, and tubercle has a U in it. But when we get to the femur, they're called trochanters. Greater bump, greater trochanter, lesser trochanter. All right. We have on the back, and it's kind of hard to see here in the video, but you can kind of get an idea. There's a ridge. The front of the femur is smooth, but when I point it over to the back, it comes to a ridge, and that ridge is called the linea aspera. Linea aspera comes from Latin. Linea means line. And this is really important because that ridge forms a really nice attachment site for the adductor muscles, which we'll get to next unit. Ridge on the back of the femur, linea aspera. Going towards the bottom, we have condyles and smaller ones on the back called epicondyles. So the big old condyles, the femur, it comes down to an end like this. These are big old medial condyle, lateral condyle. How are we going to tell the difference? Just like the humerus, the medial condyle is the rounded edge on the same side as the head, medial, and the lateral condyle is the rounded edge not on the side of the head. Medial condyle, lateral condyle. On the back, we have smaller little bumps, and they're kind of hard to see, but I want to try and be more specific. So if I ask you, what is this big rounded edge? Well, it's a big rounded edge, lateral condyle. Whereas if I ask you, what is this small rounded edge? Lateral epicondyle. It's on the back and it's smaller. What is this smaller rounded edge? Medial epicondyle. It's on the back, same side as the head. All right. No one's going to miss patella. It is a kneecap. I could ask you as the individual bone, or I could ask you on the skeleton. Right, the patella is right here. See it over here. Please don't say kneecap because you won't get it correct. Say patella. Then we have the two lower leg bones, the tibia and the fibula. Be careful with the spelling. I don't even want to say how you could mix up those two because then it's going to get in your head. Tibia is the big one. It is also more medial. So if we look at the lower leg here, we can see the tibia is more medial and the fibula is more lateral. All right? Okay, tibia, big. On the tibia, we have a front ridge called the anterior crest. Some books will call it anterior border. Either one is okay. This is what you think of as your shin. So this is pretty much underneath your skin. There's not any muscle or fat over top, so if you hit your shin against something, it really hurts. Well, that ridge on the front of your tibia is called the anterior crest or anterior border. If we go down towards the bottom, we have a little bump that extends down, and that is called the medial malleolus. What we're going to find out is that the fibula has a lateral malleolus, but the medial malleolus is what comes down on the inside of your ankle. And I'm going to show you. We're friends by now, right? So if you look at your foot, kind of hard to see. There we go. If you look at my foot, there's a bump on the inside of your ankle, and that medial bump is called the medial malleolus of the tibia. There's also a lateral bump, and that is what we're going to find out to be the lateral malleolus of your fibula. We're getting nice and personal here. Why not? So the medial malleolus is the bump that comes down on the tibia. One last thing on the tibia, there's a bump towards the top called the tibial tuberosity. You can feel this pretty easily on yourself too. If I had shorts on, it would be better. But if you come right down from your knee, you'll feel a bump. If you were younger and you had Osgood-Schlatter's, you would have inflammation on this bump, but pretty easy to feel. So if you come down from your patella, right below your knee, you'll see a bump called the tibial tuberosity. All right, my friends, the fibula is the smaller lower leg bone. And all I'm going to ask you for the fibula, you can actually cross off head. Don't worry about head. But on the fibula, we have the lateral malleolus, so it's a little bump. The other side is a little bit fatter, but the lateral malleolus is a little bit more pointy. And together, the medial and lateral malleolus form a nice little hood that goes over the foot. We saw this in the forearm bones. Form the styloid processes, the radius and ulna, form a nice little hood to go over our hand. Well, here we have the medial malleolus of the tibia and the lateral malleolus of the fibula, and they form a really nice little hood that goes over your foot. Okay. Something else I want to point out, I was talking earlier about how the bones are connected. I'd like you to review that the knee joint is formed by the femur and the tibia. The fibula does not articulate or connect with the femur. So your knee joint is really your tibiofemoral joint, the joint between your tibia and femur. We're almost done! Foot! Guess what? You don't need to know the individual tarsal bones. All you need to know is that this back collection of bone is called bones, is called the tarsals. Then we have the metatarsals, and then we have the phalanges or toes. Tarsals, metatarsals, phalanges. T for toe. All right, folks, there'll be one more video on joints, and then we'll be all done. Good luck.